They're more popular than ever, and not just with adults.
The growing concerns over e-cigarettes and the rise in use among kids. What you need to know so you can talk to yours about the dangers.
Electronic cigarettes, also known as e-cigarettes, have become really popular, bringing in nearly $2 billion in revenue a year. Earlier this year, the FDA announced proposed rules to ban the sale of them to minors and require warning labels on all the products. But there has been growing concern on the health risks for e-cigarettes, especially among teens. Last month, the CDC found that e-cigarette use among middle and high school students doubled between 2011 and 2012, and that continues to rise. Man, it doubled. Here to talk about how parents can best discuss this with their kids, e-cigarettes, is Dr. Ari Gilmore from Pacific Medical Centers. Thank you for being here. This is really kind of a new conversation. I mean, we're used to talking to our kids about certain drugs and alcohol and preparing them, but I don't know, e-cigarettes, we don't know a lot about them. They haven't been out that long. What's the difference that we know between an e-cigarette and a regular cigarette?
Yeah, that's right. And we're getting a lot of questions in our clinics as well from patients. The first thing to think about is that e-cigarettes are really a device to deliver nicotine, and it's important not to lose sight of that's what it's there for, to give nicotine. The big difference between a cigarette is that you're not burning the tobacco, you're taking a purified form of nicotine, mixing it with polyethylene glycol, which vaporizes, much like you might see in one of those smoke machines for Halloween. That brings the nicotine up in a way that you can inhale it, plus or minus some flavorants.
Okay, so why do you think kids are so appealed to this? Why are we seeing that number double among kids using it?
Yeah, well, definitely the flavors make them more accessible, and smoking a cigarette's hard. It's harsh, it burns. You know, it's not easy to get addicted, and our real concern is with the ease of getting a nicotine buzz, these could really lead to some higher nicotine use.
But that's important that you point out is you're still getting nicotine, so the health risk is still there. And before we started chatting here in this interview in the break, we were talking about the fact that we just don't know a lot yet about the health risks because they haven't been around so long.
Right, exactly. I mean, we all know nicotine is going to increase your risk for heart disease and high blood pressure. Clearly, it's very addictive. The benefit may be in the future that there's less lung cancer risk because you don't have the byproducts of burning, but at the same time there's no regulation on what's actually in the fluid. We're also seeing a move towards people filling their own cartridges, kind of a trade in bulk quantities of nicotine mixtures that are then being prepared on site by someone in their garage or basement, and I certainly wouldn't want to put that in my body.
No, that's not a practice you don't want to be involved with. So let's talk about parents and having those conversations that we all need to be having with our kids about drugs and alcohol, but add e-cigarettes to that. What is that conversation? What is the warning we should be making sure that our kids are aware of?
Yeah, that's an excellent question. I think the first thing is making it very frank. And so when I talk to children in my clinic or advise families, I advise them to really talk about the nicotine and what it does. Use a statement like what people are doing might make them feel like it does when you're having an exciting moment in a volleyball game and you make the winning shot, a little burst of euphoria. But you're getting it in a way that's not sustainable. You know, we'd rather you go out and do something that you enjoy, be physically active. For people who haven't had the chance to have moments of feeling good, they may really end up being addicted to it. And people who never thought they would be caught up in wanting nicotine, after only a few weeks of trying, could end up finding they have a hard time stopping. I think it's important that kids know why someone would use something like that. Saying, oh, it's bad, or just don't do it, doesn't necessarily work. They're seeing, you know, Hollywood stars use them, so of course they're going to think, well, if someone else like that uses it, maybe I should give it a try.
Yeah, but the addictive quality is still there, the nicotine is still there, the health risks that we know of are there, and there could be even more that we don't know of. How do we know what your kids are vaping, the signs to look for? Because I guess the concerning thing is you can't really smell it. It's not as potent as a cigarette.
Yeah, exactly. You very well may not know. Up to 10% of high school students have tried in the last year, so it's out there. You just have to have those frank conversations, let them know it's okay to ask questions, and explain why some people might use it and why you would prefer they don't. And then you have to have a little bit of trust.
Try to get to them before they even have the opportunity to try it is kind of the ideal thing, but important conversation to have. Thank you for the knowledge and sharing your information, Dr. Gilmore. Appreciate it.
All right, thanks for having us.
Matt, Walter?